Peace be to you. Assalamualaikum. Omar, physician associate, health educator, and endurance athlete here. So I want to talk to you guys who are applying to PA school about a very important course. You'll probably have this even if you're planning on attending medical school or nurse practitioner school also. So it's history and physical exams. So it may be called Physical Introduction to Physical Diagnosis, depending on what program you attend. So I'm an erstwhile PA professor. About 20 years ago, I did that for a few years. So I taught from this book. There's many editions out, newer editions out, obviously, after 20 years. But Bates is really like the go-to book for teaching this course, Guide to Physical Examination and History Taking. So this is really the bread and butter for those of us who are clinicians. It's where you're going to learn to use this, your stethoscope, your tuning fork for your Weber's test, and your Renee's test behind the ear here. I'll do some tests later, but that's one of the ways in which you use that. You're going to learn certain concepts also. You're going to learn to use the old hammer. You see people doing this, reflex hammer. You're going to learn about that. This reflex hammer has got this is like a filament, so you can test people's fine touch sensories. There's things like the Panacean corpuscles within the skin. You can test with that. Different cranial nerves. You're going to learn to use your otoscope for looking in the ears and in the nose, the nasal turbinates also. You're also going to learn, this is interchangeable heads. It's important to learn to use your otoscope for looking in people's eyes. So for you're going to look at things like macular degeneration and retinal arteries and veins. You're even going to learn to use these things. You go to the doctors and they tell you to stick out your tongue and stick this down your throat. So you learn about gag reflex. There's a lot of things that you're going to learn in physical exam and history taking. What else do I have here? I got a blood pressure cuff. This is a automatic blood pressure cuff, but with a digital readout. But I've got behind me, so you can see here, the old-fashioned blood pressure cuff. That's what I was trained on. I was also a nursing student back in I think it was 1991, so about 31 years ago. So I was trained on old school equipment. But things never change in terms of your ability to do a physical exam and history taking. Most of your diagnoses are going to come from a good history and physical exam. So you're going to be asking the patient about things like smoking, dietary habits. They're going to come in for aches and pains. I would say that the three things that bring patients into the clinic are the 3 Ps. So pain, parents, and paperwork. So if they're in pain, they're going to come into a doctor's office or a hospital. If they need paperwork done, so maybe forms for SSDI, so Social Security Disability, or physical exam clearances if they're about to go to school or compete in athletics, whether it's high school or college, or if they're trying to get into some program like a police academy, or they need an annual physical for something like a bus driver or something like that. And then parents, appearance, it actually begins with A, but I say parents. So they have some kind of anomaly. So maybe if some new lesion or something shows up on their face or even their body, like, what's this? What is this? So you've got to be able to do a good history on that patient and then do a good sound physical exam on them. And I'll show you guys the difference between a focused physical versus a fairly expanded physical later. But this is a really good book. You don't have to go out and buy this book if you haven't gotten into the professional phase yet. This is probably, if you want to do some extra reading before you start your program, you can always, I'm sure you can get it on on Amazon. There's other physical diagnosis books out there, but this is really the go-to book that's probably used in most programs. But this shows you how to auscultate the lungs and do things like percussion, palpation. What else do we have? Just an oral exam. You can see all the stuff that goes wrong with the teeth. Some people have got really poor oral hygiene, and they may be taking medications that will cause changes in the gingiva. They may have things like leukoplasia, depending on what diseases they may have. What else is in here? I don't want to show any of the pictures of people with no clothes on. Oh, here. So you'll be able to diagnose different diseases. Here's how the appearance appears with, remember I was saying appearance. So people with different disorders may come to your office and say, hey, what's going on with me? What's going on with me? You know, I've changed, my appearance has changed over time. So acromegaly, myxedema, nephrotic syndrome, Cushing syndrome, parotid gland enlargement, Parkinson's disease. You're gonna, you know, when you get to be an experienced clinician, you're going to be able to diagnose people right away in some cases. All right, this guy's got, you know, this, and this probably. And then you're going to also be able to form different, what I call differential diagnoses. So this is a very important course. The fundamentals that you need to even be able to be competent in this course is anatomy and physiology. So I've got behind me the classic anthology of anatomical charts. So it's got anatomy and some pathology in there. Your anatomy is really the what, you know, what we're made of. So our hands, eyes, nose, throat, all this other stuff. The physiology is how it functions. The pathology is the disease manifestation. And then with a physical exam and history taking, it all comes together. And you're going to learn very basic fundamentals. So you'll probably take this course maybe in the first semester, just an introductory course, and then it's going to build upon that. So you'll be able to do a full physical by the time you graduate. And it's very important. A lot of students sleep on this course because it may not be as hard as physiology or something like clinical chemistry or pharmacology, but you've got to do something called a practical exam, where you actually go through a physical. You actually perform the physical on maybe your classmate, or sometimes models come in, and you could practice on them, or do your practical exam on them. A lot of students mess up. I've had to fail a couple of students because they didn't do a good job on their physical exam. But for those of you guys who are applying to your respective programs, I'll do some short videos about how to use, you know, these various tools. Your best tools are your eyes, your ears from listening to what the patient's saying, and then your hands also. Palpating for things and percussing. So that's it for now. I wish you guys the best of success in your positive endeavors. If you are a pre-PA student, you can feel free to reach out to me. I'll leave my information in the description section. If you're planning on applying to medical school, I'm not the person that you would want to contact because I'm not a doctor. I'm a PA. You can contact somebody like Dr. Andre Pineset, the study doc. But, you know, these are things that you're going to have to know regardless if you're a PA, a doctor, especially if you're an internist or a nurse practitioner. All right, that's it for now, guys. Take care. Peace.